Hey, welcome back to Live on Purpose TV. I'm Dr. Paul, and today we're talking about parenting a child with ADHD. ADHD tends to be a very complicated constellation of symptoms. There's no blood test that we can give to determine whether your child has ADHD. It's really a diagnosis that is based on symptoms and what we observe in children. The funny thing is, when you look through the system list, all of them are things that most children do, at least occasionally to some level. So when we make a diagnosis of ADHD, it's because many of these symptoms are appearing at a level that is higher than what we would expect for most kids. Having said that, I think we overdiagnose a bit in our society, and there are cases that we miss. But either way, it's a challenging constellation of behaviors. Now, this video is not intended to be a diagnostic video. That's not where we're going today. But if you're a parent who has a child with ADHD, or if you suspect that, or if you don't care about the diagnosis, but you're having some challenges with the kiddo, that's where I want to go today, because there's some behavioral things that we can do that make a huge difference. Now let's look at a model that I've shared in some of the other videos here in the Positive Parenting playlist. You want to check that out, okay? Get into the Positive Parenting playlist here at Live on Purpose TV, and you'll find a host of videos there that will help you in your parenting responsibilities. So let's start with a quick review of one of the most basic principles that we need to understand as parents. We'll talk about how that ties into ADHD as well. And it goes back to this graph. You might remember we've talked before about control and maturity and how these two things interact and affect each other. Control means control over your own life. It goes from 0 to 100% control. So you can have all of it or none of it or somewhere in between. And maturity has to do with how grown up you are. But it's not just about age. It's about stage. As we talk about stage, we've divided this into 3 chunks, and it's just, I label them stage 1, stage 2, and stage 3. Now remember, the less mature you are, the less control you have. The more mature you are, the more control you have. So this part under the line is the part you get for yourself, or your kids get for themselves. The part over the line is the part that we as parents take, and the control has to be shared. Kids aren't mature enough to take full control over their own life, and that's why we get to share that control. How mature they are determines how much control they get to have. Now, as a quick review, stage 1, over here on this side of the graph, stage 1 is the least mature, and that's where we have fighting and opposition and defiance and tantrums and yelling and screaming and demanding. It's a very immature stage. These things, by the way, are totally appropriate for toddlers, 2-year-olds, okay? But if you got a 16, 17-year-old doing the same kind of stuff, that's a problem, and we call that immature. That's stage 1. Now, when we move to stage 2, we stop fighting and start cooperating. In fact, I would put cooperation right on that dividing line between stage 1 and stage 2. If your child is cooperating, they're at least on stage 2. Stage 2 is much more pleasant for the parent and for the child because we're working together. There's a negotiation. At stage 2, you don't want any trouble. You want to keep the peace. And so you go along with reasonable requests. Now at stage 3, that's when we kick into true responsibility. That's where there's empathy. And that's an important term to remember. Empathy means that you understand and care how someone else feels. Do you see that changes the maturity of your child when they understand and care how someone else feels and how their behavior impacts that person? Empathy, service, morals, values, ethics, those are the things that drive our behavior on stage 3. So you can see when our kids get up to stage 3, they get to have more control. And we as a parent back off. You see this part on the top gets really small. at stage 3, because it's all about self-discipline and self-control at that point. So as we review that quick model of control and maturity, it's important to understand where our child is in that continuum, because that will determine what we as parents need to do and how much control we need to take. What does this have to do with ADHD? Or, quite frankly, any other diagnosis or condition or syndrome that our children may have. Any of those things affect a child's maturity, the way we've defined it here. A kid with ADHD, for example, is not going to be regulating and monitoring their own behavior and affect like kids who don't have ADHD. That brings them down this way on the maturity scale, which means they don't have as much control over themselves. That means parents need to kick in and take more. Does that make sense to you? So, what if it's some other syndrome? What if they've got some kind of a developmental or a pervasive delay of some kind? Well, that also brings their maturity level down. I'm not saying that in a judgmental way. I'm saying that in acknowledgement that those kinds of processes going on in a child or in a child's mind bring them down the maturity scale to where they don't have as much control over themselves. That means somebody else needs to kick in with that control. Most of what I encourage parents to do with their ADHD child, or as a parent of an ADHD child, is to get clear about the control and maturity exchange so that you're taking the right level of control as a parent. But then what we want to do is encourage our children to come this way, to train, teach, or educate them to have a higher level of control and maturity so that they can run their own life more appropriately. I think our job as parents is to work our way out of a job. So eventually they don't need us controlling their life. You see where we're going with that? So here's what I really like as a practical approach. And a big shout out to Foster Cline and Jim Fay, authors of Parenting with Love and Logic. You might be familiar with the Love and Logic people and curriculum and the wonderful materials they've made available. Great resource to us as parents, and I highly endorse what they're doing. The steps that Foster Cline and Jim Fay presented or suggested mirror these four that I want to share with you today. And it has first to do with giving them a task. You give your child a task that they can handle. How can you tell if your kid can handle it? Well, this gets confusing when we're working with ADHD or with any kind of other diagnosis or syndrome, because sometimes we're not sure if our kid can handle it. And they haven't in the past very well. I want to get past the whole motivation thing. Are they motivated to do it? And just ask the simple question, can they handle it? Are they capable of it? Here's a little quick shortcut to get there. If you, as a parent, are frustrated because they're not doing it, probably that means that you believe they can do it. They're just not. If you believe they can't do it, you're not going to feel frustrated. It'd be like, oh yeah, my kid's not up to that. So your frustration will tell you some things. Pay attention to that. If you're feeling frustrated, it's probably because you've observed maturity or traits or skills or behaviors in your child that suggest that maybe they can handle it and they're just not. So you give them a task that they can handle. Now, step 2, and I love this one. I thought Klein and Fay were brilliant when they came up with this. You hope that they blow it. Hope that they blow it. This goes contrary to what we're thinking as parents, but here's how this ties into the ADHD brain. The prefrontal part of our brain is the part that helps us to regulate our own behavior and do logic and problem solving and rational thought. That part might be getting a little lazy in these ADHD brains. We want to stimulate it to wake up. One way that we do that is through problem ownership. What I mean by that is whoever feels the weight of the problem is the person who has it. This is going to upset some of you as parents because who's feeling the weight of the problem? You are. That means it's your problem still. We want to shift that from your shoulders over to the shoulders of your little one, okay? In an appropriate way, in a way that they can still handle it. We want to take the problem from our own shoulders and put it back on their shoulders, because then if they own the problem, they're more likely to engage that prefrontal part of their brain to actually solve it. And kids are basically brilliant when it comes to efficiency. The child or adolescent mind is thinking, should I worry about this? Or should I let someone else worry about this? Oh, that's easy. I'll let someone else worry about it because that's easier for me. They'll do that all day long. When we hope that they blow it, we shift the dynamic psychologically to where they start to take on the problem. Think about it. If mom is smiling, kids are thinking. It's a pretty good rule of thumb. And if you hope that they blow it, you're not going to be all anxious about, now, did you do it? You're not going to be reminding. We call it reminding. They call it nagging, riding me, being on my case. Am I right? So we're going to shift that dynamic. And when mom's smiling and she's like, oh, I'm kind of hoping that my kids blow this one. That makes kids nervous because if you're smiling, they're thinking. We're not going to remind them. Now, remember, we got 2 more steps, so stay with me. I'm not going to leave you hanging. Hope that they blow it. Now, as we move to step 3, we're going to allow consequences to do the teaching. Consequences and, let me add another little piece here, empathy. We already talked about empathy briefly when I got to stage 3. It has 2 important components: that you understand and care how someone else feels. Let's model that for our kids. And it's not just that we're going to clobber them with consequences. No, the consequences come as the cost for their choice and for their blowing it in step 2, which is good because we wanted them to learn something, right? When we get to step 3, we let those consequences fall and then we kick in with empathy. Not I told you so. Not if you would do what I say, this kind of thing wouldn't happen. No, we're not going there. It is simply empathy. Oh, wow, buddy. This is tough, isn't it? Yeah, join with them, and you can't be sarcastic about this. It won't work. So you be genuine and connect with them at an empathic level because they're not liking the consequence. It's okay. They don't have to like it. I used to tell that to my kids. Oh, the good thing about living here, you don't have to like the consequences. And they're like, oh, Dad, right? But it's true. They don't have to like it. In fact, it's better if they don't because that's going to increase the learning. But use empathy because you wouldn't want to have that consequence either. Now, the step 4 is the powerful learning step where we get to give the same task again. This sends a powerful message. And think about how this might address the issues we're dealing with ADHD. And the message is, hey, you are smart enough. You've got the brain power. You've got the problem-solving ability to learn from your mistakes. I trust you to learn from this experience. Now, let's give it another try. Let's see how this goes. I'm watching. I'm with you. I got your back. Right? Meanwhile, they're like, oh, what? You mean I have to think about this? Yeah, we want you to do some thinking, Junior. Right? Because if they're thinking, they're not going to get into as much trouble as when they're not. ADHD interferes sometimes with that thought process and pulls us down the maturity scale. But if we'll use those steps, I think we can make a difference for these kids with ADHD. Sounds kind of challenging, but you're up to the challenge. You're a good parent, and I know that because you're here and you're watching videos about how to be even better.